Following a meeting with the Health Minister on Thursday, Operation Dudula has agreed to end its protests in front of the Kalafong Provincial Tertiary Hospital in Pretoria. The Health Minister Joe Phaahla says government was obliged by the Constitution and the law to ensure the population had access to healthcare services and no one should be refused emergency medical treatment. Let's get you more on these developments. We're joined by Musa, Ndlovu, who is with Doctors Without Borders. Thank you very much for availing yourself this morning. Having seen the situation play itself out, you thought what?
Thank you very much for having me in your program. Yes, we've witnessed the situation and it looks like it is taking a positive direction because as I mentioned in my last interview that Doctors Without Borders are for access. If the access is allowed, regardless of what step has been taken in order to allow the access, but if the patients can access healthcare, that is our concern, that is our mandate. And if that is not happening, that is the time when we will become very vocal, because it's not a matter of advocating for the patient to get access to care. It is also about working together with the department to identify the gaps and come up with innovative ideas. So we are for support, but if things are not going well, we cannot keep quiet.
What are some of the gaps that have been identified, and perhaps you can just share the plans going forward?
It's not going to be an easy thing to share the plans because government plans goes its own way. But based on what the minister, presented during the media briefing, they are working on a process of trying to make sure that the foreign nationals that are accessing services in South Africa, they engage with their countries and their government in order to look at how they can work together. That's not for us. For us, it's about people accessing healthcare if they are in South Africa. So in terms of the fine details of the plan, how are they going to do it? I think it's the government that you can ask that question, who can give you the fine details of step-by-step development in terms of ensuring that anyone in South Africa access healthcare. And should there be a need of any kind of, discussions with the neighboring countries, they engage on that.
From the work that MSF does, is what is happening in South Africa unique? If not, how are other countries dealing with this situation?
The challenge with access to healthcare, more especially for the people who are coming from outside the country, it happens in many countries. The first thing that you need to understand is that accessing the borders for the migrants, it's not an easy thing. It's happening everywhere. You look at what is happening in Europe, what is happening here in Africa, not only in South Africa, what is happening when the migrants cross to Botswana, when the migrants cross to other countries. It is the same problem that migration laws need to be reviewed globally and as well as in our region, as the SADC region.
Thank you very much for availing yourself. Musa Ndlovu is with Doctors Without Borders.